This is Greg Remke with Economic Thinking and Normal Nutrition. Economic Thinking, we hold workshops and provide resources on the economics of national high school and homeschool debate topic. The STOA League has a topic on artificial intelligence, reforming AI policy, federal AI policy. And I've also been doing a lot of research on medicine, health, and nutrition. I have a new policy paper coming out from the Goodman Institute on this. But what I want to focus on here is some of the challenges in students considering a case that would deploy artificial intelligence to advance health benefits in this country. But if the status quo, as my subtitle says, if we apply this vast computing power and have outdated theories of disease, we won't get the progress we want. So there are lock-in and institutional problems in the status quo, and that's a challenge for AI, also an opportunity. So I have a post on this. Basically, I'm giving a review of an article just posted today on artificial intelligence for medicine, health, and nutrition. So you can follow the link to see that. It's on economic thinking, and you can click on either the artificial intelligence subhead or the nutrition public health. And one of the books I draw from and have posted on earlier is The AI Delusion by Gary Smith, because what he does is looks at some of the systematic problems with the way AI is used, to sort of the phrase as a promotion, to sell stock or advance products, and some of the things that go wrong using AI in finance as well as healthcare, as well as other areas. Also, I discuss in this what I'm doing now and in the article, the work by Andrew Trask, a former homeschool debater from Memphis, who is involved, a researcher with Google's DeepMind, and also runs OpenMind and other projects. And then I recommend the Gaming AI, the George Gilder book that you can download for free from the Mind Matters. Okay, so OpenMind, privacy preserving AI. I talk about this in earlier posts and articles, but I want to reference this in the discussion here on challenges with AI. In his presentations that you can watch online, Andrew talks about the importance of gathering data and using machine learning to try and find connections between diseases and drugs and environmental factors. However, this information is protected by privacy laws, and so you need to have some sort of a privacy-preserving AI that can reach into protected databases, analyze things, and just send out the results, not compromise any private data. And so one of the reasons there isn't more of that research on healthcare is because it's so expensive and difficult to get access to these data sets. So he talks about that at OpenMind. You can read more about that and the discussion that he has, and I just wanted to reference that. And but come back with a separate challenge. Now, Andrew in his presentation talks about cancer, and what if we could look for all these relationships that might give us insight into what causes cancer. But the challenge is when you program AI, the algorithms to try and find these relationships, there are premises involved with that. For example, cancer has been thought of as a genetic disease. So billions of dollars have been spent, federal money and foundation money, searching for the genetic causes of cancer, huge analysis of the cancer genomes, and it's been a disaster. They spend all this money, they find 50,000, 500,000 different kinds of genomes in cancer, because cancer isn't a genetic disease, it's a metabolic disease. Something goes wrong with your mitochondria and causes all this damage, and that damages the DNA, which is why you find this so much DNA problems. So this is discussed in a number of books, research. You can read about this, Tripping Over the Truth, which basically goes through the history of research with cancer and how, the metabolic stuff was sort of dropped when the DNA research came out. So Otto Warburg, a century ago, said, look, what you find in cancer is that there metabolizing glucose. So it's the metabolism and there's fermentation. So that's how we find cancer right now with a PET scan, looking for where in the body is high levels of fermentation, because cancer cells can't use oxygen, or most cancer cells can't use oxygen. They burn glucose in a far less efficient way. So, but if you're spending all your money and all your AI research looking for cancer under the more popular genetic theories, you're not going to find this. At least that would be the claim that the negative could make, it seems to me, on more federal funding for cancer research or AI research into cancer. And you can read more about this, the published articles on this, and there's not much money in research on this because it's not within the realm of the American Cancer Society. The Nixon's war on cancer and Biden's recent resurgence, that again pours more money into these theories that haven't yielded results because they're, according to these critics, are on the wrong path. So here's another relevant article I talk about or link to in my recent post. Where's my thinking machine? And this is Mark Mills is reviewing a recently published book on artificial intelligence. And one of the things he points out is there's a problem, with the wording, the whole idea of artificial intelligence. It's a misguided phrase. It would be like the first, motorcycles being called artificial horses because they're like a horse except they're artificial, or the Wright brothers developing an artificial bird. They chose different names because, planes aren't artificial versions of birds, and motorcycles and cars aren't artificial versions of horses or carriages. And similarly, the machine learning algorithms really shouldn't be called artificial intelligence because it's not like intelligence. Instead, it's, machine learning. And so understanding those terms and getting that straightened out helps. So you can read more about that. Mark Mills. Now, the article's in the Wall Street Journal, which might be gated. You can find it on the Manhattan Institute. I've got the links there. And also, I just saw, as I looked today, he's got another article on robots and, of course, AI just published today on the Manhattan Institute. So I recommend all his articles on technology. They're fantastic. So again, the AI delusion, more on the AI delusion is an interview with the author on Mind Matters AI, and part of it looks particularly at Watson, which is the IBM AI device and or technology, and it was applied to medicine. The idea is we're going to figure out all these things by examining 50 billion, medical records, and it's been a complete flop, as it was with accounting for H&R Block, it turns out. And the problem is these AI systems, they can do amazing things, but they're not intelligent, so they can't figure things out. And there's fun stories on this, but it's also dangerous if you're using AI, for military, for finance, or for medicine. You've got to understand the constraints that are in what's called artificial intelligence. So discussed in the article I posted recently on a presentation by Dr. John Campbell, who reviews recent medical research related to COVID, the pandemic, and lockdown. And in a recent post, he looked particularly at studies of vitamin D. And again, if let's say you're using AI to look for the cause of COVID. Okay, so you search all these things, but here we find just with a straightforward study, you find like an 80 or 90% reduction of severe or critical COVID just by having vitamin D, adequate vitamin D. This study from Israel, people with low vitamin D way more likely to catch COVID and to have severe symptoms. So 14 times more likely if you've got patients with low vitamin D. So, let me go back to that. So the question is, if you have this big AI system looking for sources of COVID, is vitamin D going to be part of the search? And how is that going to work? And could we learn from this and use AI to look for vitamin D and maybe other things that are linked to vitamin D or that are linked to COVID and vitamin D? So just ending. Post critical of AI. This is one of the leading AI researchers, and he just says there's a real problem. We're not anywhere close to what people sometimes think the science fiction view of AI. Let's take advantage of the great things that can be done with these machine learning tools and algorithms, but understand we're not. There's limitations. So cognitively, there's just a long way away from what we want. What we'd like to have. And so applying AI to medical disease and things like that, we're a long way from where, the theories cause the problem, I guess I'd say. And this is more, it's a problem to call everything AI. It just doesn't work that way. And he discusses this in an interview you can find online. Okay, and in my presentation, I mentioned more diabetes, obesity. Again, these are considered chronic problems in the status quo, but nutrition researchers find you can reverse type 2 diabetes simply by reducing carbohydrate consumption, cutting out processed foods and sugar. Your blood glucose stabilizes in a couple hours. In a couple weeks, you can actually reverse diabetes. People come off insulin, they come off other drugs. It sounds crazy, like a miracle, but we have hundreds of doctors working on this now. And yet the status quo, the American Diabetes Association has been, until they had somebody who's president who was a type 2 diabetic who put their diabetes into remission with dietary changes. That was the first time the organization acknowledged it, even though researchers have known this for decades. So there are real problems with lock-in in the status quo, believing that cancer is a genetic disease, believing diabetes is a chronic condition and should be, treated with low-fat diets when that doesn't work for most people. There's lots more on this. Dementia as type 3 diabetes. Well, maybe you treat that with diet as well. So much research, but more money into federally funded or state-funded AI projects is going to put the money into the hands of the people in charge of current research, which is, in a sense, slowing progress because the nutritional intervention proposals can't get funding. They're not considered, and doctors can get in trouble even for suggesting people who are obese just cut carbohydrates, or type 2 diabetics cut carbohydrates. It's not in the standard federal guidelines. They have to push the federal dietary guidelines. Okay, and these are other places you can find more. Our Normal Nutrition podcasts on Podbean, our YouTube videos there, and also in Normal Nutrition Substack page. And of course, we have them here on Economic Thinking in both the AI and the nutrition public health section. Thank you for listening.